那第三个问题哈，那我们呢经过了新冠的这3年，那我们说其实现在新冠它也并没有完全的消失，或者说未来我们还可能会面临其他的困难，可能突然的那中国的患者他就没有办法来到曼谷去进行一些胚胎移植了。那对于这些都是他们的宝宝们来讲，他们都会非常的担心。那我们想要听就是像医院给我们一些解答，关于这一块的管理方面会不会有一些预备的一些方案啊
？Okay, in terms of patient safety, I mean, the first thing, of course, is that we must maintain a high level of patient safety for those patients that are coming here. Okay, so we have to keep abreast of the international and the national guidelines of the latest trends in the COVID virus, or indeed any virus or any emerging virus. So that we can keep updated and we can adapt very quickly with new strategies to any situation. Having said that, at the moment we maintain a very high vigilance in the clinic. We still maintain, as I said before, the telemedicine and everything to minimise the amount of time patients have to come to the clinic, and therefore minimise the interactions between patients at the clinic. In respect of those patients that can't come or feel that they can't come and are worried about samples they may have in cryo storage, we're still maintaining the highest vigilance. Our tanks are monitored daily. They're completely safe. We've been open for over 16 years now. We've never had a problem with our cryo storage or embryos or eggs in storage. If we were to face this situation where our cash flow became very poor and that we had to close operations, there'll be two situations there. One would be that we may still be able to maintain keeping our cryo storage in-house and have a minimal embryology presence to maintain those samples, those frozen samples in storage. In a worst case scenario where we are essentially bankrupt, then in that situation we already have risk management agreements with another couple of large clinics or large hospitals to send the samples there and maintain the cryo storage at their facilities if necessary. Meanwhile, as I said, we also have to be ready, have supplies of like masks, PPE, all those sort of safety equipment in-house, ready to, if there was an upsurge somewhere in the world, be ready to introduce as many safety measures as possible. Also keep a more than normal supply of drugs, of medications, and other consumables, so that if there was as happened in the COVID, there was some interruptions to the supply chain, we would still be able to maintain our business, our treatments and services during that period. Also have to look at that, can we scale up and treat a lot of patients very quickly who might want to come through very quickly before the pandemic perhaps hit Thailand. So these are the sort of things we would look at. We of course also have to maintain robust communication channels with patients, with agents, with other doctors and collaborators, so that we can keep them informed of the situations at all time.